Hi, everyone, and welcome to our June virtual Connect with Network Health event. I'm Kelly Vanderwheelen, the Senior Community Engagement Coordinator here at Network Health. We're so glad that you are here with us today on this beautiful Wisconsin day. The sun is shining here in Greenville, and we're just really excited that you could join us from the comfort of your very own home this morning. I have two very special guests here with me today. And first, I'd like to welcome my Network Health colleague, Katie Myers. Katie is the Manager of Care Management at Network Health. Hi, Katie, welcome. If you could just tell us a little bit about yourselves and also about Network Health, that would be great.
Certainly. Hi, everyone. It's great to be here. I'm Katie Myers. As mentioned, the manager of the care management team at Network Health. I'm a registered nurse, and I've been lucky to be with Network Health for 12 plus years. I was raised in Wisconsin, and after about 15 years in Oregon, I moved back here to be with and raise my family. A little about Network Health. For over 4 decades, Network Health has established strong roots in our local Wisconsin communities by putting our members first. We're co-owned by 2 high-quality health systems, Froedtert Health and Ascension, Wisconsin. At Network Health, we strive to make the extra steps to make health insurance affordable and understandable so our members can make the most of their coverage. Network Health improves the lives of local business owners, individuals, and families as we pursue our mission to create healthy and strong Wisconsin communities. Our employees demonstrate their dedication and passion to helping others improve their life, health, and wellness by getting involved in the organizations that serve our communities. We put in the extra effort because we want to, not because we have to. We know you're our family and our friends and our neighbors, so we're side by side with you in our Wisconsin communities.
Wonderful. Thank you so much, Katie. Thanks for being here. We appreciate it. All right, and then Katie and I are excited today to be joined by Christy Myler from Fox Valley Memory Project. Carrie unfortunately could not make it with us today, but we are so excited, Christy, to have you here. Thank you for joining us. Christy, if you could tell us a little bit about yourself and the Fox Valley Memory Project, that would be great.
Sure. Well, thank you so much for having me today. I'm so glad to be here. My name again is Christy Millard. I'm a resource navigator with Fox Valley Memory Project. I've been here for a little over a year now and just love supporting this community. Fox Valley Memory Project, our mission really is to collaborate with other organizations and build communities that welcome, include, and support persons with dementia and those who care for them. Some of the programs that we have offered are as listed. Memory Link, which is the program I work with, and I help support caregivers and people living with dementia at home to find those resources and education and really just walk that journey with them. We have MindWorks, which is our respite program, aging and intellectual and developmental disabilities programs, because we know that those with some of these developmental disabilities as they age increase in risk of developing dementia as well. We have memory cafes, support groups, On a Positive Note chorus, and then we also do dementia aware trainings where we go out into the community and help train other businesses so that they can be dementia aware as well.
Great. Thank you so much, Christy, for sharing such important information and resources to share today. Before we get started with our conversation today, I just wanted to share a few things that what you can expect for joining the event today. So first, I will cover just a few housekeeping items with everyone, and then we will lead into this important community conversation to discuss topics around dementia. Our presenters and myself look forward to sharing this valuable information with everyone and also connecting you with those community resources like Christy had just mentioned to support you and also your loved ones. We'll also have time for questions at the end, but important to remind you that if you do have any questions during today's event, please submit those by typing them in the Q&A at the bottom of your screen. Before we begin, I just have a few housekeeping items to cover with everyone. First, if you have any technical issues during our event, please leave the webinar and try joining again. To leave the webinar, simply click the Leave button in the lower right-hand corner of your screen. Again, if you have any questions, feel free to use that Q&A button at the bottom of your screen. We will have time to answer those questions for you. To protect your privacy, please do not submit questions with any personal information in them. If your question is too complex, we may also direct you to our member experience team at Network Health, and that number is listed here, 800-378-5234. After the event today, there will be a short survey. If you could please help answer those questions in the survey, there's only 3. Give us your feedback on how we did today. We'd really appreciate it. I also do want to mention that within the survey, there is an area for you to leave us any questions or feedback that you may need, and we will be happy to follow up with you after today's presentation. All right, so first, we'd like to spend some time understanding why today's conversation is so important for us and for those around us. So Christy, I'm gonna turn it over to you to help us understand, some of these statistics.
Yeah, so as you can see, this is where we currently stand with Alzheimer's disease specifically. So just out of the total US population, we have 6 million people that are living with Alzheimer's disease. By 2050, it will increase to nearly 14 million. At the age of 65, 1 in 10 has Alzheimer's disease. This is the 6th leading cause of death in the US. 1 in 3 seniors die with Alzheimer's or another form of dementia. And this kills more than breast and prostate cancer combined. So it really is an issue. From 2000 to 2019, the number of Alzheimer-related deaths increased by 145%. There is currently no medications for prevention.
Hey, I'll let you just continue
Sure.
with the early memory screenings and the diagnosis for Alzheimer's. If you could just touch base on that for us and really help explain more.
Right, no problem. So why do we need early diagnosis of dementia, and why is this so important? So early screening and diagnosis opens the door to future care and treatment. It really helps people to plan ahead and to make important decisions. Access to the right services and support and help to take control of your condition and plan for the future and live well. It gives a person a chance to explain to family and friends the changes that are happening in their life. It also helps with early financial and life planning. Evidence that early diagnosis helps you continue to live independently in your own home for longer. Treatments may be more effective with earlier diagnosis, especially with some of the new medications that we're hearing about.
Thanks, Christy. As you said, based on strong evidence, early diagnosis helps those affected by memory loss to continue to live independently and in your home longer. So where do I go? Where do we go? Where do we go to find out more about memory loss, or if we might be concerned about our own or a loved one's memory? A lot of people go to their personal doctor to talk about their memory or thinking concerns. That's recommended. They're your partner in care. Your doctor will evaluate your overall health and identify any conditions that could affect how well your mind is working. When talking to your personal doctor about memory and thinking problems, ask how familiar they are with diagnosing dementia and whether there may be circumstances in which they would refer you to a specialist. The types of specialists listed below or examples of those can evaluate memory and thinking issues and diagnose dementia. Those with unclear symptoms, including those under 65, may require evaluation by 2 or more specialists and combine their findings to reach a diagnosis. Some examples of these specialists that you might be referred to are a neurologist. A neurologist is someone who specializes in diseases of the brain and the nervous system. And a geriatrician, that's somebody who specializes in the care of older adults and dementia. Consider bringing a list of your questions to your appointment so you're prepared to talk about your concerns.
Great. Well, thank you for sharing this helpful information. My next question is, after someone or their loved one is diagnosed with dementia, what next steps are most important and who can they turn to for help? Christy, I'll start with you on that one.
Sure. So really, you want to make connections with your personal health care providers. Like said before, they're the ones that have the most history with you. They know you the best and your healthcare concerns. So really making those connections, as well as getting in contact with us, the Fox Valley Memory Project. We can really help you find those resources out in the community. We are a very resource-rich community. Lots of people out in the Fox Valley here to help you. You might want to check with your local Aging and Disability Resources Center, which has that nice little acronym there, ADRC. They have dementia care specialists there as well that can help. And then also the Alzheimer's Association. You can connect with them either by their website or by the 24/7 helpline, which is really helpful.
Okay. Into the next area here. So Christy, do you want to talk a little bit about, why establishing a routine is just really important?
Right. So establishing a routine throughout the day is going to be very important to help keep both you and your loved one kind of on track throughout the day, having something to look forward to and kind of keep you in a rhythm throughout the day. So you really want to tailor routines to their preferences. Okay, think about if they've always brushed their teeth before breakfast or always have ice cream after dinner. You want to maintain that routine. That's something that they're familiar with, so you want to keep that routine. Try to stay flexible and patient. With this disease progression, their abilities are going to change. Okay, so and their ability to do things at the same speed is going to change as well. So you're going to want to be patient. Patience is going to be key for reinforcing a sense of independence and accomplishment. This disease can make things, everyday activities, a little bit more difficult. And so making sure that you are just really encouraging them for the accomplishments that they're making throughout the day is going to be important. Let them help without correcting them. Okay, sometimes that's a challenge, but just letting them help and letting them do the things that they can do without trying to correct. Maybe it's not the same way you would like it, but try to let them do that without correcting them. Make daily activities a part of the routine. So things like having a consistent meal time, placing their meds next to the beverage at breakfast, when they bathe and when they dress. So keeping all of those kind of activities as part of those daily activities, as part of that daily routine. Maybe considering a routine walk with a family member or a caregiver, or an exercise program at a senior center can be beneficial to patients, preferably 3 or more times a week. That's very important to keep physically active. Activities that can help establish a sense of time. Okay, so if we're thinking about maybe that daily TV show that they enjoy, or a Sunday special meal, especially if that's something you've always done together. Opening the blinds in the morning and closing them at night. That can also help with that daytime, nighttime routine. You want to add daily activities that bring them pleasure as well. Okay, things like listening to music. That's a great connection. Working on arts and crafts, if that's something that they've enjoyed. Find ways to still incorporate that into their day. Maybe they enjoy gardening. You can garden all year round. When it's nice out, get outside and garden. When it's cold out, have a pot inside that you can plant something.
Right. Another topic that we really wanted to share with others is that rearranging. Katie, Christy, if you have information here for us, that would be wonderful.
Sure. So really that caregiver perspective that we might want to look at here, when somebody's attempting to rearrange things, may be helpful to kind of view that rummaging as a loved one's attempt to rearrange things to make better sense for them, or to do something familiar. Okay. They could be looking for a familiar item. They may be, and they may not be able to tell you what that item is. So they may be rummaging through things to try to find that. They may be hungry, bored, or even anxious. And so they're rummaging through different things. This could even be an enjoyable activity for them, sorting or going through familiar, reassuring items. You might want to take some precautions for this, though. I would highly suggest removing items of value or maybe dangerous items. Think of those items that could cause injury, and remove those from the area. Provide a rummaging drawer or box to make this rummaging activity safe and enjoyable. Consider buying duplicates of an item. Have a specific focus, and maybe some of those items that are frequently lost. Get a few of those items so that you can replace it. And then maybe even consider sorting socks or folding washcloths. If you think about it, this is a purposeful activity, much like doing the laundry. So having an easy basket or box filled with socks or washcloths that could be sorted or folded would be helpful. There's also something to think about in the case of wandering. Okay, you might want to talk to your doctor about a new or concerning behaviors. Wandering can happen. Somebody might be looking for a way to get outside. Maybe they're looking to go home, even if they are home. So talk to your doctor about these behaviors. And then you might even need to place some signs throughout the house. Place signs on doors to try to help redirect away from doors. You could even use alarms or different tracking devices, different GPS devices to help manage or monitor movement. These work and are very helpful, and oftentimes people can just wear them as watches. You might want to reduce restlessness with a regular supervised exercise. That might look like going out for a walk during that time that they might be prone to trying to go for a walk on their own anyways. And then you might have to think about continuous supervision. What does that look like? Do you need somebody to come into the home? Do you need some home care? Could you reach out to different community resources, maybe volunteer activities, or volunteer that could be at home with your loved one for a while? And then there's also adult daycare or respite services too that you could get your loved one involved in. All of these would help that decrease the chances of wandering, and even decrease that rearranging and packing thing that could happen at home as well.
Christy, this is Katie. I echo that these are great opportunities, and there's a lot of ideas out there to help support people when their loved one has new symptoms. And I want to echo that, if there is a marked change in behavior, it's a really good idea to have someone give you a second look, like your personal care doctor, just to make sure there's not some other health concern causing the anxiousness or the change of behavior. But knowing that, given that this is a normal sort of change in the behavior in the disease process, there are resources and ideas for coping. Thanks, Christy.
Great. Thank you.
All right. Thank you both. So next we want to talk a little bit about driving. That is an area of concern for especially caregivers that, are trying to really care the best that they can for their loved ones. So if one of you could just talk about this a little bit and how people can be prepared and be supported.
Sure. So, I mean, families and caregivers really need to think about and be warned about the potential liability for accidents, right? They may need to take possession of the car or the keys and restrict driving at some point. Predictors of unsafe driving include some of the following. So forgetting how to locate familiar places, right? Failing to observe traffic signs, maybe a slow decision making in the traffic, especially in the Fox Valley. We have a lot of those roundabouts and can really make for some confusing driving. Driving at inappropriate speeds, either too fast or too slow, confusing the brake and gas pedals. All right. Maybe your loved one is forgetting their destination. Things like hitting curbs or becoming angry and impulsive or confused while driving. All of those can really be signs that it's time to start thinking about how do we make this a safe situation. Sometimes thinking about in the last 5 years or so, have there been any accidents or citations? Okay. Is your loved one starting to self-restrict driving? Are they feeling uncomfortable with driving? Sometimes that's the case, and that may be a little bit easier to work with than to in that transition. Maybe your family members or caregivers are starting to assess that driving is not safe anymore. And so really talking with family members about that. A person could even have a mini mental state examination at their doctor's office. And if they score less, or 24 or less, that's a good indication that driving is no longer safe. You might also want to just consider that impaired cognition is only one limiting factor in driving for older persons. Medication and sleep disorders might also be something to consider, along with visual and motor impairments. All of these should be considered when assessing driving safety. Sometimes families ask about how can I have my loved one evaluated for driving? At the earliest stages, a person with Alzheimer's disease may begin to have difficulty with complex tasks such as driving. Although family and caregivers can watch for signs of unsafe driving, a proactive strategy would be to get a comprehensive driving evaluation by an occupational therapy driving rehabilitation specialist. And that really can help families know, and the person with dementia know that, it's time not to drive anymore. That evaluation provides a more objective understanding of the current impact of the disease on driving capacity, and results in a plan of options as well. The goal is always to retain the highest level of independence and mobility in the community, and so we want to be sensitive to that. The initial recommendations may include strategies to reduce driving risk during the early part of the disease. The occupational therapist can offer strategies specific to the individual's goals and needs. The American Occupational Therapy Association website includes a national database of driving specialists, as well as a wealth of resources for both persons with Alzheimer's disease and their families.
All right. We have just a few more important tips about driving. So Katie or Christy, if we want to just talk about those things as well.
Mm-hmm. Yeah, discussions of driving cessation are very challenging. This is definitely one of the things that I hear the most about when I'm working with families. It's a hard conversation to have. So you really want to plan to discuss how retirement from driving will be handled before it becomes an issue. Okay. Try to be sympathetic and acknowledge their feelings. It's really important. Surrendering a license is often represents a severe loss of independence for them. And so there's going to be, most likely, there's going to be strong feelings about that. I think patients are generally unaware of their deficits. They oftentimes may think that they're driving just fine, where family members are having more of that concern, particularly with their deficits in judgment. And that's part of the disease, that deficits in judgment. So they're not always accurate assessors of their own driving ability. Patients are generally aware. Some patients are generally aware of their deficits, particularly maybe those that are in those early stages. With early diagnosis, many patients with mild dementia will still be able to drive safely for a period, but will eventually progress to the point where it's no longer safe for them to drive. So really, family members are going to have to keep a close eye on that. Starting this conversation, when the conversation doesn't go well, and oftentimes it doesn't, this is, like we said before, this is a big step for somebody. So we really want to be patient. You want to initiate the dialogue to express your concerns, stress the positive, and offer alternatives. I think that's going to be key, is offering some driving alternatives. You're going to want to address the resistance while reaffirming your unconditional love and support. It's important to really understand that there's most likely going to be resistance, and you're going to need to be, empathetic, but yet still firm. You want to appeal to the person's sense of responsibility. Most of us want to be those caring people out there, want to take responsibility. So kind of appealing to that, and stressing the importance of not only their safety, but other people's safety. You could even ask their personal doctor to advise the person not to drive, either in person, by writing a letter, or even a prescription stating that the patient must not drive anymore. Involving a doctor in a family conference on driving may be more effective than trying to persuade the person not to drive by yourself. Oftentimes there's that family dynamic, especially if it's adult children trying to tell their parents what they can or can't do anymore, that can kind of get sticky. And so having that professional step in and say, it's not safe anymore, and you just can't do it anymore, is oftentimes more effective. You can then use this letter or prescription to remind your family member what's already been decided. I think it's important to also consider an evaluation by an objective third party. Understand that this may be the first of many conversations that you have about driving. With dementia comes the inability to remember that you've had these conversations already. And so you're going to have to get comfortable with having this conversation several times. When the conversation doesn't go well, some people give up driving easily, but most don't. And it can be very difficult. So be prepared for the person to become angry with you due to the memory and insight issues that are part of the Alzheimer's disease. So it's very common. Most families that have to have this conversation struggle with, I don't want my loved one to be angry with me. Unfortunately, this is something that sometimes will happen. Again, you just want to be patient and firm, understanding that empathy. again, acknowledge the pain of this change and appeal to the person's desire to act responsibly. This is a big change for them. It's going to be a hard thing to go through. And so just really appeal to their responsibility. I think praising them and encouraging them, saying something like, you know what, Dad, I'm just so thankful that you're concerned and you're thinking about this and you're thinking about other people's safety as well as yours. And really ask other respected family members that maybe have a little bit of authority, or even an authority figure like your family attorney, to reinforce this message about not driving. Again, sometimes having that outside person to talk into this can be helpful. As a last resort, you may need to take away the car keys, disable the car, consider selling the car. When you do any of these things, be sure to provide safe, reliable alternative transportation. Okay, that's going to be so key because they still need to get places. They're still going to want to go places. And so sometimes making sure that you have that plan ahead of time can help ease that concern that they're going to have about, if I can't drive, how am I going to get somewhere? If the conversation doesn't go well, don't blame yourself. Okay, this disease can impair insight and judgment, making it very difficult for people to understand that their driving is no longer safe. The disease can also cause mood and personality changes that make reactions more pronounced.
All right. And then just a few other tips that we want to share with people that joined us today on the driving.
Sure.
Yeah,
So,
Christy, this is Katie. I've been, the way I'm thinking about this is, I imagine that the loss of driving, something you've done your whole life, leads to kind of, a sense of loss of autonomy. And so I think you really emphasized a lot about, taking initiative, but also providing alternatives. So this is when you can pull in your community, right? This is when you can pull in the family and the friends and check on resources and, understanding the situation of your family member who you know pretty well and how they may react, or they have a change. Like, one of the things that comes with a memory loss is, there might be some personality traits that tip up that normally were tipped down before that circumstance happening. So imagine those transportation options as alternatives and offering those and pulling in family and friends to take people places such as the memory cafes, or keeping people, allowing, arranging family member time calendars to drive, taxi service, other transportation services that you might have to pay a little bit for, or that the community offers. But also, coming along on errands, like going to get the prescriptions, the groceries, or even getting a meal delivery as an alternative. I really think you hit on those really well, and just trying to put myself in those circumstances, and I imagine that loss of driving, that can be a tough one.
Yes, it really is. It's one of the main concerns that I'm hearing families deal with, especially in that early to mid stage. And so I think that when you come alongside somebody that is losing that, and let them know that, just because you're not driving doesn't mean that we're not going to get you to places, or that there's not other alternatives to get you to the places that, number one, you need to go to, and number two, you want to go to. That's part of somebody's independence. So making sure that they still have the ability to do those things is going to be key, and focusing on that aspect of this change, that they're still able to go to the places that they want to go to. They just don't have the stressor of driving there themselves. So trying to turn that, what might be a negative, into a positive, and focusing on that positive is going to be key. And that really takes a lot of planning ahead. It really does. So you're going to have to take a step back and really look at your situation, because every situation is unique, right? So for people in the very early stages of Alzheimer's, it's never too soon to start planning ahead on how you're going to get around when you can no longer drive. If you can get your family member in the early stages of this journey to be a part of these decision-making events, that is going to really help make this transition a little easier. So putting a plan in place can be an empowering way to make your voice heard as the person with memory loss, to try to plan these things out early so you still have, you feel like you have control and a say on what's happening is going to be very important. So really, what are some of these tips? So you want to stay remembering that each situation is unique. You want to really cater this towards your own family situation. What works for one person may be totally different than what works for another person. And what works one day might be totally different than what works the next day, even within your own situation. So remember to remain flexible. You can get information and support you need from the Alzheimer's Association, and we've got the number listed up on the screen here. Great resource to use. They have a lot of good articles on driving. You're going to want to involve family and close friends in the plan, because like we talked about before, you might be depending on some of these family and friends to really help once driving is no longer happening. And so including them early in the discussion is going to be important. You are going to want to confront resistance, okay, and really be empathetic. You're going to want to empathize with those who are uncomfortable having a conversation, and stress the importance of preparing for the future. This is an uncomfortable conversation. Confrontation can be difficult. And sometimes you have family members with differing ideas of what should happen. So really trying to come together and plan early rather than in a crisis moment is going to be important. When the person is still in the early stages of Alzheimer's, ask them to sign a driving contract that gives you his or her permission to help them stop driving when the time comes. Again, this is best done in those very early stages of the disease process. You're going to want to talk about some of those transportation options, okay? Use special transportation options as far as thinking outside the box, that them driving is not the only transportation option available. So there's many options people can explore that will allow them to continue to travel independently and remain in control of their mobility. Things like transition driving responsibilities to others, like we talked about before. Maybe that's an opportunity for families to come together and choose different days or events that they're going to take their loved one to. Arrange taxi services. There are several services out there that help seniors get to where they want to go. Use special transportation services for older adults. You can access local resources using a free community resource finder or elder care locator to search for transportation services. That's where it's going to be really important to get connected with your ADRC throughout your county. They can really help arrange those kind of services for you. You're going to want to reduce the need to drive by having maybe prescription medicines or groceries or meals delivered. All right, for some of those not so fun things that we have to do, maybe those things can be delivered and reduce the need for going out into the community to get those things. You can learn much more from different websites like National Transportation Resources, connecting with Fox Valley Memory Project, and connecting with your ADRC to find out all the resources within our community to help you get to where you or your loved one wants to go.
All right. So one of the other questions that we hear often is, how do I know when it's time to move my loved one into a community assisted living or memory care? So if one of you or both of you could touch upon that and share, you know, when is it time to move, and how do we go about making those decisions?
Yeah, that's a tough one, right?
Yes.
You know, most people want to stay home for as long as possible. And so this is usually one of those other hard discussions to have. And many times, you know, when I'm talking to family members, they're asking all of these types of questions. You know, how do I know? How do I know when it's time? And a lot of times we'll have conversations about, you know, some of these things that are listed here, like as the caregiver, what is your burnout and stress level? Okay, are you at the end of your rope? Even after, you know, getting connected with all the many resources in our community, has the disease progressed to such that you're at the end of your abilities to continue caring for somebody at home? This can be stressful. It can be very stressful, especially, you know, if this is the first time you're going through this. Okay. So we talk about caregiver burnout and stress and what that looks like. And then there's, you know, is your loved one really struggling with those activities of daily living? And that can be things like showering, getting dressed, eating, you know, all of those kind of things. And has it gotten to the point where you as the family caregiver are struggling with helping them with those things? And maybe you've even reached out and got caregivers in the home, but it has gotten to be more difficult even for them. Okay, so thinking about that. Maybe there's difficulty with managing some behavior changes. Okay. Sometimes with dementia, there can be some major behavior changes, major changes in, you know, mood, personality, and some of those challenges can be scary to somebody that's not gone through it before or doesn't know how to redirect those things. Or it's just gotten to the point where it's not safe to stay at home anymore because of some of these behaviors. So that, you know, you really have to take a look at that and see if you're able to manage that in a safe way or not. There's also things like wandering and falls. We touched a little bit on wandering before, and there's things that can be done in the house to help that, but it's a real concern. And even with some of the best precautions, it can still happen. And so if your loved one is really struggling with wandering away from home, if you're having to, you know, try to go find them or contact the police consistently to get them back home, you know, that's really something to consider. That's a safety issue. It's something to consider then. And even falls. You know, there's lots that can be done to prevent falls, but even a whole lot of prevention, you can't assure that there's not going to be falls, especially with certain types of dementias. So, you know, if you're seeing a lot of that, then again, that's a safety issue to consider, and it might be time to start thinking about moving into long-term care. You know, a very real thing that pops up too is refusal of care. Maybe your loved one is refusing to have anybody else come into their house. And maybe it looks like when the caregiver does come over, your loved one says, "Get out of my house." And so you're really struggling with trying to provide that 24/7 care or just that assistive care in the house because of refusal. And that can be a very real thing as well. Some other issues that might pop up are delusions or hallucinations, which can be common with many forms of dementia. And for a family member that may not know how to redirect, or they've tried several ways of redirecting and they just haven't found something that consistently works, and they are concerned for either their safety or their loved one's safety. We talk about that. Decline in physical health. Okay, sometimes things happen with our bodies, and even in the progression of dementia, that we just need that 24/7 care. We need more care than what maybe I, as a family member, could provide, or an in-home caregiver could provide. So really thinking about and talking closely with your doctor about what that might look like. And then the very real possibility of depression and isolation. We strive really hard within Fox Valley Memory Project to help people to understand that there are lots of social connections that a person can make, lots of support groups, lots of help out there, but it's a very real thing for either the person with dementia or their caregiver to experience depression and isolation. There can be a lot of grief that people are going through, both because of the loss of those plans, right? Many of us have plans for retirement that didn't include dementia. And so oftentimes people can go through depression with this too. So really taking a look at all of these things and always being open to the possibility that we may have to consider at some point, when is it safe, when is it the best option to find long-term care for my loved one, both because of myself as a caregiver and for my loved one that might need more extensive care than what can be done at home. And so these are all things that people think about, and that the many resources in the community can help you plan and kind of work through and talk about too, so that you're able to plan before there's a crisis situation where you need to make that move quickly.
Thanks, Christy. I found in our work in care management, we lean heavily on community resources to help people get through circumstances like this, and they can be really alleviate a lot of stress. So organizations like yours, the Fox Valley Memory Project, and of course our county ADRCs, or which you can search engine or call ADRC. ADRC also has a wonderful catalog, a paper catalog that you'll find around the community if you're a paper person. But they also have a lot of online resources and someone that can actually come to you and help you through these things. There's an organization in Northeast Wisconsin and a few counties up in Northeast Wisconsin called Care Patrol, which is also another great resource for discussing these types of things and exploring when is a good time and what kind of care might be needed, and helping to pinpoint some providers, or even going into a facility and touring it with you and helping you find the questions to ask. If you don't know, there's people out there that can help you. So if you're overwhelmed, just reach out.
Yes, so important, Katie. Thank you. So we have about 10 minutes left, and I do want to take some time to ask our attendees what sort of questions they might have. And we do have one at this point. Someone is wondering, what do they attribute the increased cases of dementia? What is it from? Does Christy or Katie, do you have any thoughts behind, what is being attributed to the increase?
Well,
Go ahead, Christy.
sure. Studies have shown that the number one increase or reason for increase in Alzheimer's and other dementias is that we are living longer. Okay, the advancement of age increases your risk of developing dementia. Dementia is not a normal part of aging, but your chances do increase the older that we get. So as we are, as a generation, as a country, as we are aging and we are living longer, we are seeing an increase in dementia. And so there's lots of different diseases and lots of different reasons on why that is. But the leading one is that we're living longer.
Okay.
Yeah, and I think it's important to remember that there are some modifiable risk factors, right? So we have tendencies in our families to have certain risk factors, but also you have control over some things. Like if you have diabetes, managing that diabetes well, to manage your vascular system and your blood sugar and taking care of your organs and your mind. Hypertension, high blood pressure, that can be modifiable with medication and diet and exercise. So it's important to talk to your personal doctor about those things. An increase in obesity, kind of managing yourself so you have a healthy weight, or at least exercising and a healthy diet so that you can manage that risk factor. Physical inactivity can be common in our culture, and just a little movement every day decreases your risk. So just thinking about, how can I incorporate more steps? How can I get up and down more in my chair? How can I work on squatting so that I can sit and stand easily? Not smoking. Of course, we all know at this point in our culture that smoking is a very dangerous activity, and it's a really good idea to try and stop smoking, no matter how long you've smoked or what kind of how that is in your world. It's a good idea to stop smoking and get support to do that. And then also managing your mental health. Depression can be a big risk factor for all of those things. That can lead to poor diet, that can lead to physical inactivity, and that can just be, part of who you are. But managing that, recognizing and managing that, and talking to your family and your providers about that as well, that can really help to alleviate some of those risk factors as we age.
Yes. Thank you both. Important information to think about. One of the other questions that we do have is someone's wondering, what's the difference between Alzheimer's and dementia?
Yeah, so dementia, if we can think of dementia as an umbrella term, okay? Dementia is a term that talks about all the symptoms that a person is experiencing, things like memory loss, the challenges in language, the inability to kind of think through problems or rationalize. So in all of these kind of things that are affecting a person's daily life, okay, that's what dementia is. It's that big umbrella term. Alzheimer's is a specific disease that shows up in these different symptoms. So you can think of it like kind of like cancer is that big umbrella term, and then breast cancer is a certain type of cancer. So Alzheimer's is a certain type of dementia. Okay, does that explain it a little bit better?
Yeah, I think it does for me, Christy. Thank you. I
Mhm.
think it's important to understand those things, definitely. So we have just a few other, we have someone that is giving you a shout out, Christy. She says she had worked with you last year with her mom's dementia. So you had recommended a book, Christy, Creating Moments of Joy Along with
Yeah.
the Alzheimer's Journey by Jolene Brackey.
Yes. Yeah.
So great suggestion. Thank you so much to our attendee today for mentioning that. And Christy, shout out to you. Thank you so much for all that you do for people really needing these resources and information. And thank you to the person that recommended that book as well. So we also have another question, and we just have a few minutes, so we'll probably take this question. And then I just want to remind everyone that if you do have more questions, please leave those in the survey. We do have an area for you to do that, and we will follow up with you one-on-one to make sure that you have the answers that you need. So cost of care is a real limiting factor for seniors and their families. What kind of options do people have in these sort of situations? That's one of the questions that came in.
Yeah, so typically I like to get people connected right away to the ADRC because they can really help a person with that kind of, financial planning. Finding out what they qualify for, what kind of benefits they might qualify for, and really walking through that with them. There's also other avenues to do that, whether it's, if you have a family attorney that you can talk to about that. But yeah, that's a real thing. It is long-term care of any kind, whether it's having somebody in your home or living in a community setting. It's expensive. It really is. And so getting you connected to the right resources so that what your options are is super important. And so, getting connected to the ADRC, they have somebody there called an elder benefits specialist, and they can even come out to your home and sit down and just have that conversation with you, really go through paperwork with you, help you apply to different things that you might qualify for, and just help you figure that out. So I highly recommend them to all of the clients that I work with, making sure that they're connected with the ADRC.
Yeah, I agree. I think that it circles back to early planning, right? Early screening, early diagnosis, and early life planning as a whole. I mean, this is something that we can all, outside of a memory diagnosis, really think about pulling in your family or your friends or community and seeing what are my resources. And those are also opportunities to talk to your family about what resources can we provide as a family. Who can we depend on? Can we depend on our faith-based community? Can we depend on some other organizations or where can we convert money into care? So is there an opportunity for me to get some help with my light bill? Or get a lower cost generic medication, get the kid down the street to volunteer for high school hours by mowing my lawn, saving that money somehow and converting it into where it matters most, which is the care. Another opportunity is to look at your health insurance plan and really think about, will I save money if I'm in plan and go to an in-plan provider versus an out-of-plan provider? Or where can I get help to coordinate my care so that it's more efficient and cost effective for me and my family?
Right. Thank you. Those are great tips. Really appreciate it. All right, so we have talked about a lot of community resources. Thank you both for mentioning all of them to people that have attended today. I also want to mention just a few of the events coming up with Fox Valley Memory Project. There's a few that Network Health is involved in as well to support people throughout our community. For those of you in the Southeast area, Spark is at the Museum of Wisconsin Arts. So you can just visit wisconsinart.org and look at the schedule. Fox Valley Memory Project has a couple of really great events coming up. We do have the flyers listed here. But again, want to remind you, we're doing another partnering event coming up in October. In fact, our medical director, Dr. Hassan, will be joining Fox Valley Memory Project out at Heckrot Nature Preserve in Menasha for a wellness walk. So great way for you, your family members and friends to come and join us and have a nice walk with us in nature and learn more about resources available for you. So again, I just want to thank everyone for joining us today. Katie, Christy, it has been a pleasure, and we just are so thankful for both of you and the resources and information that you could share today. I'd also like to encourage our people that have attended today to check out Network Health on social media. We have Instagram, Facebook, a lot of ways that you can check us out and look for upcoming information and events that you are definitely more than welcome to join us at. So again, thank you for joining us today. Please don't forget to complete the survey at the end of our event today. We want to wish you all a wonderful day. Thank you again. Take care. Bye-bye.